Hello, and welcome to Next Generation Behavioral Health.
10-minute tips for modernizing patient care.
I'm Dr. Christina Armstrong.
And I'm Dr. Julie Ken. Christy and I work in the Department of Defense, helping make mobile apps, web, other kinds of technology to help military and veterans and their families, especially with behavioral health.
That's right. Our team develops and evaluates health technology, and we also train behavioral health providers on how to integrate technology into clinical care. And in this podcast, we share answers to the most common questions we hear.
And we do it in 10 minutes, or you get your money back. Today will be especially challenging because we have a really exciting guest, Dr. Amanda Edwards-Stewart. She is a licensed clinical psychologist in the Department of Defense, and she's been involved in some of the most innovative projects in military behavioral health. Thank you so much for joining us, Dr. Stewart.
Thanks for having me.
Dr. Stewart, how do you describe your role in the Defense Health Agency?
I lead the Innovations Program, which is made up of a chief technology officer, a developer, and myself, and I serve as what we call the subject matter expert. So I get the idea for what technology we should play with, test out, and then I try and come up with a integration for that technology with some sort of behavioral health concern or problem.
How do you pick the new technologies that you assess for future use for military and veterans and their providers?
That's a great question. We usually try and pick the technology through environmental scans of what technology is out there, who's using it, what seems to be up and coming and is popular with users as well as development companies. But we don't just do it based on the technology. We also try and get feedback from our end users. So that could be behavioral health providers, it can be service members, their families. We want to find out what it is that they want and what they need.
After you find a technology you're interested in, what comes next?
Well, next, what we usually do is we want to find out how safe that technology is for our end users. So if we're going to use it, it should be pretty safe. And our developers actually will do something called ethical hacking. So anytime we find a new technology, we try and hack it and find out what are all the problems with it and where data can get lost or stolen by more malicious hackers. And then after we sort of determine how the privacy and security work for that particular technology or software, so either a hardware or a software, then we come up with, or I come up with a proof of concept, which is, let's take this technology and let's put it in a certain context that is appropriate for behavioral health care. And let's actually build that out as cheap as we possibly can to find out all the possible limitations, see if it works, see if we can even build it, get an idea of how much it would actually cost to do it full scale. So that's generally what we do.
So, Dr. Stewart, if I'm a listener who's interested in what's coming around the corner, which technology should I be paying attention to?
Yeah, we want to be the cool kids on the block.
Yeah.
So tell us what we should be. Yeah.
Well, I think you guys are pretty cool, but I will tell you what I think in terms of technology is sort of up and coming. Augmented reality isn't a new technology, but it's something where we're starting to get some bigger players that are interested in it, like Apple and Microsoft. So I actually think the potential for augmented reality is pretty big, and I think we'll see some great things in the future that sort of can tie into behavioral health care. Wearables are just exploding. So most people know about smartwatches, but there's even wearables that are things like little patches that you can attach to your skin that'll get biometric data. So like your heart rate, your breathing, that has the potential of even like being able to record sleep through things like movement and light exposure. And I think that wearables that integrate in like your shoes, Nike has something like that, or athletic clothing is also a really popular area. Other technologies that I think have great potential are sort of what we'll call broadly the Internet of Things. So technology that integrates in some way with anything that's available via the internet. Like you can see this with like Alexa or Google Home, where you have like this hub that integrates with a whole bunch of other apps. So things that control your light switches and allow you to order things online just through verbal commands. So I actually think there's a lot of use, and that's probably an area that's just going to get better and better and have more competitors in it. And The last area I'd mention is the integration of something called big data with artificial intelligence, which uses some machine learning as well. So I'll give you an example of what that might be. It's usually taking a lot of different sources of information. So like patients could have all of their medical records associated with, say, like their health biometric data with wearables. And if we can take all these things, all these sort of sources of information, somehow combine them and then create an algorithm. So the artificial intelligence part of it that determines like if there's a relationship between the days that you feel depressed and like you've stopped moving those days, you're laying down more, things like that. So that can provide useful information to patients and providers alike that say, well, maybe not, maybe you shouldn't be doing this behavior. Maybe actually there's a better way to do this. And it gives the patient immediate feedback about how they're doing. So I think all those areas are sort of what are up and coming.
That's fantastic. I know we are almost out of time here, but do you have any advice that you would give clinicians listening about how to integrate health technology into caring for their patients?
I would tell providers not to discredit their patient information when they come in with some kind of commercial technology. So if they have like a Fitbit and they want to show you their data, get excited about it too. That means you have a patient who's willing to participate in their treatment and they really want to give you information. So try and figure out what that information is and how it can be integrated into your sessions as opposed to discrediting it.
That's great advice. Thank you so much for joining us today.
Thanks for having me.
I hope we can invite you back to talk about some of the apps that you helped develop.
I'd love that.
Thanks for joining us on Next Generation Behavioral Health. Please let us know what new health technologies are exciting to you.
Connect with us on Facebook and Twitter at Military Health. And thank you for subscribing and rating us on iTunes or wherever you find podcasts. Be sure to listen to our other shows and check out our free mobile apps and websites for the military community. Next Generation Behavioral Health is produced by the Defense Health Agency.